Did you know that a single routine blood test, one you may be taking every year without question, could quietly mislead your doctor, trigger unnecessary treatment, and even put your health at risk without you ever feeling a thing? For Americans over 60, this isn't fear-mongering. It's the unsettling reality hidden inside today's medical system, where some of the most commonly ordered tests offer little protection. While the tests that could save your life are rarely mentioned at all, new findings from leading geriatric researchers reveal a troubling pattern. Seniors are being overrested in ways that create confusion, anxiety, and misdiagnosis. Yet at the same time, they are missing the very tests that predict heart attacks, stroke, kidney failure, and age-related decline years before symptoms appear. It's a dangerous imbalance, one that leaves older adults believing they are fine when in truth, no one has looked in the places that matter most. Tonight, we're going to uncover the truth. The 4 blood tests seniors should avoid, and the 4 tests every older adult should be getting, but almost no one does. And what you learn here could completely change the way you age from this moment forward. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Part 1. 4 tests elderly people should avoid. 1. Annual PSA screening for prostate cancer. For many men over 60, the PSA test has become a yearly ritual, something done almost automatically as if it were a guaranteed safeguard against prostate cancer. But what most seniors are never told is that this test, when used routinely and without clear medical indication, can create a chain reaction of fear, misdiagnosis, and unnecessary procedures. The unsettling truth is that PSA levels rise for many reasons unrelated to cancer: age, benign prostate enlargement, mild inflammation, even recent physical activity. Yet, a single elevated number can trigger a cascade of biopsies, invasive testing, and treatments that carry real risks for older adults. Doctors with decades of geriatric experience warned that up to half of abnormal PSA results in seniors are false alarms, leading men into anxiety-filled months and exposing them to complications such as bleeding, infection, or long-term urinary problems. Research from the U.S. Preventive Services Task Force has repeatedly shown that routine PSA screening in older adults often detect slow-growing tumors that would never cause harm in a man's lifetime. But the treatments for these tumors can profoundly reduce quality of life. Consider the case of Harold, a 72-year-old veteran from Ohio. One slightly elevated PSA led to 3 biopsies, weeks of sleepless nights, and eventually a surgery he didn't truly need. The tumor was harmless, yet the surgery left him with incontinence he battles every day. "I went in healthy," he told his physician afterward, "and I came out with a life I didn't recognize." Stories like Harold's are far more common than most seniors realize. This is why specialists now emphasize individualized decision-making rather than annual automatic testing. PSA can save lives when used appropriately, but used blindly. It can take away peace, dignity, and independence, things far more precious in our later years. And if one common test can be this misleading, wait until you see the next one. An exam many seniors repeat far more often than they should, without knowing the hidden risks it carries. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Over-frequent wide-panel vitamin D testing. Vitamin D is essential for bone strength, mood stability, and immune health, especially as we age. But in recent years, many seniors have been pulled into a cycle of repeated wide-panel vitamin D testing every few months, often without any medical reason beyond habit or clinic protocol. What most people over 60 don't realize is that excessive testing can do more harm than good. When doctors examine thousands of cases, they frequently see a pattern. A single mildly low result leads to another test, followed by another, and soon the patient is placed on high-dose supplements that their body may not even need. And when vitamin D is taken at unnecessary or excessive levels, it can silently raise the risk of kidney stones, heart rhythm problems, and dangerous calcium buildup in the arteries. Issues especially serious for older adults. Experienced geriatric physicians warned that vitamin D levels naturally fluctuate with seasons, diet, weight changes, and even lab variability. A small dip is normal. It does not mean the body is failing. Yet, seniors are often told that any number below a certain line is an emergency requiring aggressive correction. This is how individuals like Margaret, a 68-year-old retired teacher from Arizona, find themselves in trouble. After a slightly low reading one winter, she was tested again and again, each time prescribed higher doses just to be safe. Within a year, Margaret developed severe flank pain, kidney stones caused by excessive supplementation she never truly needed. Her doctor later admitted the situation could have been avoided with a more measured evidence-based approach. That is why experts now recommend testing vitamin D modestly and only when justified by symptoms, bone disease, or specific risk factors, not as a recurring routine for every senior. When done too frequently, this simple test can lure older adults into a false sense of danger and push them toward treatments that carry their own hidden risks. And if a harmless-seeming vitamin test can spiral into such complications, the next test on our list reveals an even more surprising truth about how easily seniors can be misdiagnosed by the numbers alone. 3. Overly detailed thyroid panels, free T3, reverse T3, and expanded markers. For many seniors, a simple conversation about fatigue or mild weight changes quickly turns into a sprawling thyroid workup filled with unfamiliar markers, free T3, reverse T3, T3 uptake, and other add-ons that sound scientific but rarely offer meaningful insight for older adults. Experienced endocrinologists warn that these expanded thyroid panels often create more confusion than clarity, especially after age 60. As we grow older, the thyroid naturally slows and lab values shift in ways that are completely normal for aging. But when doctors rely on these hypersensitive markers, even a minor fluctuation can look alarming, leading to a diagnosis of borderline hypothyroidism that may not exist at all. This is where real harm begins. Many seniors are prescribed thyroid hormones they don't truly need, medications that can push the heart into dangerous rhythms, worsen anxiety, and increase the risk of bone loss. It's a quiet danger that rarely gets discussed. Consider the experience of Robert, a 74-year-old widower from Minnesota. He went to his doctor complaining of winter sluggishness. One expanded thyroid panel later, he was labeled mildly hypothyroid despite having no true clinical symptoms. Within months on thyroid medication, Robert developed persistent palpitations and unexplained weight loss. A second opinion revealed the truth. His original TSH and free T4 were normal for his age, and the extra markers had simply misled his physician. "I thought I was doing the right thing," Robert said, "but the treatment nearly cost me my independence." This is why geriatric specialists emphasize a simpler age-appropriate approach. Evaluate TSH and free T4 first, and treat the patient, not the noise in the numbers. Older adults deserve clarity, not a maze of misleading data that turns normal aging into a medical crisis. And if thyroid testing can be distorted this easily, the next test proves just how quickly inflammation markers can send seniors down an even more dangerous path. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. High sensitivity CRP testing during minor illness or recent injury. For seniors, the high-sensitivity CRPTE or HSCP often carries an emotional weight far heavier than the tiny vial of blood it comes from. This marker is meant to measure low-grade inflammation tied to heart disease. Yet countless older adults unknowingly take the test at the wrong moment, right after a cold, a flare of arthritis, a dental infection, or even a simple stumble that bruises the knee. In these moments, HSCP can skyrocket for reasons that have nothing to do with cardiovascular danger. But when seniors see a frighteningly high number, panic sets in. Doctors pressured by the result may order stress tests, imaging, or initiate medications that were never truly necessary. Geriatric cardiologists frequently warn that HSCP is extremely sensitive, too sensitive, in fact, to be used casually. It reacts instantly to infections, injuries, or inflammation anywhere in the body. That's how someone like Eleanor, a 76-year-old grandmother from Michigan, ends up trapped in a spiral of fear. After a winter cold, her HSCP was tested as part of a routine check. The result came back 4 times higher than normal. Within weeks, she was pushed through a treadmill stress test, an echocardiogram, and multiple medication adjustments. Only later did her specialist explain that her elevated number was simply the tail end of an ordinary viral infection. Her heart had been perfectly healthy the entire time. Eleanor held the report in her hands and whispered, "I lost a month of my life to worry over nothing." This is why experts insist P should only be measured when a senior feels well, free of infections, and at a stable baseline. Used correctly, it can guide prevention. Used carelessly, it becomes a source of fear and unnecessary interventions. And if a single inflammation test can send someone into weeks of turmoil, just wait, because the next section will reveal the surprising blood tests that truly matter, the ones that could change the course of aging itself. Part 2. 4 very important tests. But few people over 60 get them done. 1. APOB, the single blood test that reveals your true heart attack risk. For decades, seniors have been told to keep an eye on their LDL cholesterol, as if that one number alone could predict the health of their heart. But cardiologists with years of experience caring for older adults now agree LDL can look perfectly normal while dangerous cholesterol particles silently build inside your arteries. That hidden danger is measured not by LDL, but by APOB, the marker that counts the actual number of cholesterol particles capable of causing plaque blockages and heart attacks. For people over 60, this test is often far more accurate than traditional cholesterol panels. Yet, shockingly, most physicians never order it unless the patient specifically asks. APOB exposes risks that routine tests completely miss. Research in JAMA cardiology shows that seniors with high APOB but normal LDL face a significantly higher chance of heart attack or stroke because APOB reflects the particles that physically damage artery walls. It tells the truth beneath the surface. This is why doctors who specialize in preventive cardiology call APOB the smoke detector of the cardiovascular system. It warns you before the fire erupts. Take the story of Linda, a 69-year-old grandmother from Colorado. Her LDL had always been fine, so she assumed her heart was safe, but her daughter, a nurse, urged her to ask for an APO test. When the result came back dangerously elevated, Linda was shocked. She started treatment and lifestyle changes immediately. 6 months later, her cardiologist told her that catching the problem early may have prevented a major cardiac event. Linda still keeps the original lab report in a drawer, a reminder that the test she had never heard of might have saved her life. And if APOB can uncover threats hidden in plain sight, the next test reveals something even more unsettling: early heart damage that can happen long before symptoms ever appear. 2. HS troponin, the test that detects silent heart damage before it strikes. For many older adults, heart disease is imagined as something dramatic: chest pain, shortness of breath, or a frightening emergency in the middle of the night. But cardiologists who treat seniors every day know a harsher truth. Long before the first symptom appears, the heart often sends quiet, invisible warnings. High-sensitivity troponin, or HS troponin, is one of the few tests capable of detecting this early injury. Tiny amounts of heart muscle stress that builds slowly over time, especially after age 60. Yet, despite its power, this test is rarely offered during routine senior checkups. It stays hidden behind hospital walls, used only in emergencies, even though its greatest value may lie in prevention. HS troponin measures microscopic levels of troponin leaking from heart cells, something that can rise years before a heart attack. Studies in older adults show that seniors with slightly elevated HS troponin have a dramatically higher likelihood of developing heart failure, arrhythmias, or cardiac events in the next decade. To a trained geriatric cardiologist, this quiet elevation is the equivalent of a whisper from the heart. "I'm struggling. Consider James, a 73-year-old retired firefighter from North Carolina. He felt fine, just a little more tired during morning walks. His standard labs looked normal, so his concerns were dismissed as getting older. But during a community heart screening event, an HS troponin test revealed subtle elevations. Further evaluation showed early-stage heart dysfunction that would have gone unnoticed for years. With treatment, exercise adjustments, and close monitoring, James stabilized. His cardiologist later told him, "Without that test, we would not have caught this until the damage was far worse." HS troponin doesn't predict fear. It prevents catastrophe. It gives seniors a chance to strengthen their heart before symptoms appear, before independence slips, before a crisis unfolds. And if this test can reveal the earliest cracks in heart health, the next one uncovers something even more fundamental: the level of inflammation silently aging your body from the inside out. 3. Omega-3 Index, the test that reveals how fast your body is aging on the inside. Many seniors take fish oil or try to eat heart-healthy, believing they're doing enough, but without knowing their omega-3 index, the actual percentage of EPA and DHA inside their red blood cells, they're essentially driving in the dark. This single test shows how protected your body truly is from inflammation, the silent force behind heart disease, memory decline, painful joints, and even early aging. Yet, despite decades of research, most people over 60 never hear about it, and most doctors never offer it unless a patient specifically asks. Scientists have repeatedly found that a low omega-3 index is linked to a shorter lifespan, higher risk of sudden cardiac death, and faster cognitive decline. For older adults, this is especially crucial because inflammation naturally increases with age. Omega-3 levels determine whether that inflammation burns like a manageable ember or flares into a slow-moving fire that damages organs year after year. Experienced geriatric physicians often say, "An omega-3 index test tells me more about a senior's future health than their entire lipid panel." The consequences of neglecting this test become painfully clear in stories like that of Susan, a 71-year-old from Oregon. She took fish oil every morning, convinced she was protected. But after months of unexplained fatigue, mental fog, and joint stiffness, her daughter urged her to get an omega-3 index test. The result was shockingly low. Her body wasn't absorbing the supplement at all. With guidance from a cardiologist, she switched to a higher quality omega-3 source, improved her diet, and retested. 3 months later, her levels rose, and she felt noticeably sharper and more energetic. "I thought I was doing everything right," she admitted, but the number showed otherwise. The omega-3 index doesn't just measure nutrition, it measures resilience. It reveals whether your body is aging faster than it should and whether you can slow it down. And if this test uncovers the inflammation shaping your future, the next one exposes an organ that fails quietly for years before anyone notices until it's almost too late. 4. Urine albumin to creatinine ratio, UACR. The quiet test that detects kidney decline years before symptoms appear. For many seniors, kidney disease is something they believe they'll feel when it happens, maybe through pain, swelling, or changes in how often they use the bathroom. But nephrologists who care for older adults know a tragic truth. By the time symptoms appear, nearly half of kidney function may already be gone. That's why the UACR test is so vital. Unlike routine blood work that detects kidney problems only after significant damage has occurred, UACR identifies the earliest stage of decline, when tiny amounts of protein start leaking into the urine long before the kidneys begin to fail. Yet most seniors never receive this test unless they insist on it. What makes UACR so powerful is its sensitivity. Even a slight rise in albumin can signal that the kidneys are under stress from high blood pressure, diabetes, inflammation, or simple age-related wear. Geriatric specialists call it the canary in the coal mine, the earliest warning that something isn't right. And for older adults, early detection is everything. With the right changes, kidney decline can be slowed, sometimes even reversed, allowing seniors to avoid the exhaustion, swelling, brittle bones, and heart strain that accompany worsening kidney function. The consequences of missing this test can be heartbreaking. Henry, a 75-year-old from Pennsylvania, learned this the hard way. For years, his routine blood tests came back normal, so he assumed his kidneys were fine. But when he finally had a UACR test at his daughter's urging, the result revealed significant early damage that had gone unnoticed. His nephrologist told him, "If we had caught this 5 years ago, we could have prevented half of this decline." Henry remembers the moment vividly. "I thought I was safe because the numbers always looked okay," he said. "I had no idea the real danger was hidden." UACR protects seniors not with fear, but with foresight, giving them the chance to intervene long before irreversible loss occurs. And now that you've seen the 4 tests that truly safeguard longevity, the final question becomes unavoidable. How do these tests fit together to build a roadmap for aging stronger, longer, and with clarity about your own future? A blueprint for stronger, longer living after 60. When you look back at all 4 essential tests, ApoB, HS troponin, the omega-3 index, and UACR, a single truth becomes unmistakable. Aging doesn't have to mean uncertainty. These tests don't predict doom, they reveal opportunity. They shine a light on silent changes in the heart, blood vessels, inflammation levels, and kidneys long before those changes steal strength, clarity, or independence. For seniors who want to stay active, live confidently, and remain in control of their health, these tests form a protective shield, one built not on fear but on knowledge. What makes these tests so powerful is how deeply they complement each other. ApoB uncovers hidden cardiovascular threats. HS troponin detects early heart strain. The omega-3 index measures internal inflammation that accelerates aging, and UACR exposes kidney decline before it becomes irreversible. Together, they create a full picture of your body's true biological age, something standard annual panels simply cannot do. And for older adults across America, this knowledge is more than medical data. It's the difference between reacting to illness and preventing it, between living cautiously and living fully, between losing independence and protecting it for years to come. This is your roadmap, one grounded in science, shaped by decades of clinical experience, and designed to give every senior the chance to age, not with fear, but with foresight. Because once you understand what these tests reveal, one question rises above the rest. If something this simple can change the course of your health, isn't it worth asking for starting today? These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.